dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View.
I'm Yvonne Dunitz. Welcome to The Health View. Today we're going to be talking about COVID-19 pandemic and the impact it has and continues to have on children and their families. My guest is Nicole Manassi. She holds a professional licensure as a mental health counselor in the states of New Hampshire and Massachusetts. She has provided mental health services to children and their families in a variety of settings, including hospitals, residential programs, schools, and outpatient facilities. She currently works for Foundation Medical Partners, providing individual therapy and parent coaching services. Welcome, Nicole. We're delighted to have you here with us.
Thank you so much.
I'd like to start us out with what are the ways in which the COVID-19 pandemic has impacted children and families from your therapeutic point of view?
There have been so many stressors that have come with the COVID outbreak. And the biggest change that has come out of this is this whole social distancing concept, which has generated so much stress and strain on families. Parents are juggling numerous roles between working from home, implementing remote learning, parenting 24/7. Kids have experienced a great amount of loss of not being able to go to school, see their friends. They're missing out on birthday parties, graduations. Families are now together 24/7, which is something that they are not typically accustomed to, which lends itself to greater frustration and arguing. And then on top of this, we have this underlying worry and anxiety about getting sick.
That's very true. See, and that's huge because our lives have been totally shifted and impacted in a definite way. So when it comes to what parents can talk to their children about COVID-19, what would you recommend?
I would recommend having an open dialogue. Let your children know that you are here to listen to them and to talk to them about it. I would recommend, though, that anything that you say be developmentally appropriate. Use words that your child understands, and stick to the facts. Try not to catastrophize or sensationalize. Just stick to what's known.
And as far as social distancing or physical distancing, how can parents deal with that? And what would you recommend for them to do?
Yeah, so one of the best things you can do is try to implement a regular routine and structure for your child. Try to have consistent wake times, bedtimes, meal times, so on and so forth. You're going to want to ensure that expectations in the household are clear, that they know expectations regarding chores and video game usage. That'll make things in your house be more successful. Try to encourage Zoom, FaceTime, Skype play dates to maintain that social connection. Encourage regular exercise. Make sure that you're getting out of the house and try to be as creative as possible. Tap into your own inner child and try to think about what you would have wanted to do when you were your children's age. And the greatest takeaway I can give with all of this is ensure that you are taking care of yourself. Kids are looking to us as models to how to manage social distancing, how to cope with this pandemic. And if we are not self-caring in the midst of this, it's going to be hard for us to manage our emotions effectively.
And during summertime, as we're approaching it, people have had vacations or plans or their general routine of going to the beach, being at the pool, going places and being out and about. What do you recommend for them in dealing with the reality of that situation? Because social physical distancing is something that, we are seeing now through the CDC in some areas that because of people perhaps not being as vigilant in doing the social distancing, that more cases are coming out. What do you recommend for them?
Yeah, so again, have conversations with your children about what's happening, how your vacation plans, your summer plans are going to be impacted, and how it's okay to be sad and frustrated and disappointed. Talk about how you're feeling frustrated as well. Model for them how to manage that. And then try to come up with fun plans to do instead. Try to alter things. Maybe instead of, traveling to the beach, you can go to a beach in your town and socially distance there, or you can do more stuff in your backyard. Try to be creative around that. But again, normalize your child's experience. This is sad, this is frustrating, and that's okay.
And as far as parents being aware of their children's mental health, what types of symptoms should they be looking out for in case the child may, in fact, need the intervention of a therapist?
Mm-hmm. So you're going to want to look for major changes in your child's moods or behaviors. Things such as excessive restlessness, difficulty with sleep, increased or significantly decreased appetite, poor concentration, poor motivation, avoidance or withdrawal, panic attacks. Sometimes mental health concerns manifest somatically. So if your child is complaining about lots of headaches, lots of stomach aches, lots of muscle tension, those could also be indicators that they're struggling. If your child is speaking about suicidal ideation or homicidal ideation or self-harm, those are especially circumstances in which you're going to want to connect your child with a therapist. And if you have any imminent safety concerns for your child, you're going to want to make sure that you take them to your local emergency room.
And the children's ages is from what age to what age that is considered pediatric intervention from a mental health perspective?
So it's about 3 to 18 is considered pediatric for mental health. Below that, that would be more like early intervention services.
And how would people and parents reach out to get resources for them? Who would you recommend they contact?
So in the Nashua area, there's Greater Nashua Mental Health, which is a wonderful organization that has lots of services for children and families. If you're in Massachusetts, there's the William James Interface, which is also a great resource. You can call a number and they will connect you with a therapist who is going to meet the criteria that you're looking for in your area. Psychologytoday.com is also a wonderful website that will hook you up with therapists from across the country. And then there's also your insurance company. You can reach out to them and get a list of providers that take your insurance.
Okay. Now, children are spending more time managing and on electronics related to computers, their iPads, or all of that. What would you recommend to parents to manage that electronic usage during the pandemic?
Sure. So you're going to want to ensure that the parameters that you have around electronics usage during this pandemic are comparable to the parameters that you would have in place during the school year. So if you typically only allow 2 hours during the school year, you're not going to want to implement free reign around electronics currently, because you're going to have to scale that back at some point, and that could lead to significant conflict in the future. So trying to keep similar parameters with flexibility is advisable at this time.
Now, families are spending a lot more time together in that whole aspect of togetherness because they're staying more at home. Mm-hmm. Now, you must be seeing perhaps dynamics within the family as well as within husband and wife and within siblings causing maybe some difficulty. What would you recommend there as to what people can do to help that closeness, that physical closeness that they're having with each other work out well and not in any way impact a healthy relationship?
Sure. So it's really important that you are trying to get some space on a daily basis, get some time alone to self-care, to recharge, to not be on top of one another, and have your own activities that you do. Maybe you like to run, maybe your husband likes to go in the backyard and garden, ensure that you're doing your own activities and taking your own space.
Now, from a parental point of view, an adult point of view, of course, the adults now are trying to role model and work with their children. But what about resources for them, for their own?
Yeah. So again, the resources that I had listed earlier, Greater Nashua Mental Health, Psychology Today, the William James Interface, your insurance company, those sources will hook you up with therapists as well, not only children, but those have adult services also. But then again, taking moments to yourself, doing some mindfulness, doing some self-care is so vitally important, and staying refreshed and recharged in the midst of all of this.
Nationwide, they found that, or they are finding during the pandemic, that there is some concern about child abuse or mistreatment, as well as parental abuse and mistreatment that may be going on within the homes that may have already been there before, but the schools were able to oversee it and provide supports. And now that the parental family or the children are more isolated within their own family setting, there may be not the communication available to assist the child with the supports that they are needing related to the question of physical or emotional abuse. What do you recommend?
So this is a tough one because for a lot of children, school was a safe haven, and school was a place where there were additional eyes on the children, and reports of abuse or neglect were more easily made. If you are a neighbor and you have concerns about your child, in the state of Massachusetts, everybody's a mandated reporter. So if you're somebody's neighbor, you have concerns about their child, you see something suspicious, please call the DCYF hotline. It's so vitally important that we are looking out for not only our own children, but we're looking out for the children in our communities at this time.
Yes. Now, there are many concerns with the lack of knowledge of how long this is going to go on and how it's going to impact schools in general. People are wondering, the CDC did come out with what's needed in order to be followed, to have the children go home on all the different levels of the educational system. And the schools at this point have not made a decision related to what they're going to do, which has provided some major additional concern for parents because they don't know how to plan for the future. If schools are not able to meet the CDC guidelines, or if the pandemic continues, there's a concern that they do not want their children to go back into the schools because they do not want them getting sick, and they don't want that coming back to their families and their grandparents and everyone else within their unit. So related to homeschooling, people are wanting to know how they go about to get those supports for homeschooling, and should they be getting that information now so that they have a backup related to that, since the school systems haven't decided, so that they know what to do. Do you have any thoughts related to this?
So in terms of getting supports for facilitating remote learning potentially come the fall, I think trying to have lots of conversations with your child's current teacher about things that they can recommend. Educators are going to be kind of our guides during this period. So leaning on them for things that they can recommend, trying to have good structure currently with your remote learning, trying to make it as a positive experience for your child and you as you can right now will help us come the fall if this is how schooling looks.
So the types of questions that people can direct to their current teachers that their children have would be what? Because school's going to be ending very shortly. We're coming to the Memorial Day weekend, and then school ends in the beginning of June since they didn't take their vacations. So this would be the time. So what types of questions would you recommend them asking their teachers?
So how can I set up my child's learning environment to be conducive to learning? What should I have in front of them? What should I have in the room with them? How do you recommend that I keep them engaged when they start to get disinterested? What sorts of breaks should I put in place? Should I have movement breaks? Should I have sensory breaks? And what can I do if my child is struggling to access the curriculum? Who do I reach out to? What supports can I turn to if my child is having a hard time understanding what they need to do? Questions along those lines will be helpful in getting a better understanding of how to be successful in this venture.
Now, from a preschool point of view, for the real little ones that are getting prepared to come in and then, to go on into the elementary school, what would you recommend for them and their parents?
That's certainly a challenging question. Um, it's there's so much ambiguity around, is school going to happen or is it not going to happen? So I think being honest with your kids as much as you can around, this is a big question mark. We don't know. Mom and dad don't know if school is going to happen. If it does, this is what it's going to look like. And if it doesn't, this is what it's going to look like. Having that sort of dialogue could be helpful in preparing your preschooler for what could happen.
Right. It's hard to know what it actually would look like, doesn't it? Because the new normals let us know. From your perspective, what has been the most challenging part of this from a professional working in the area of therapy and helping from a mental health perspective? What are your greatest challenges?
So a lot of the things that people used to do to take care of themselves, to cope, to feel good, are no longer available to them. And as a result, they are just more stressed at their baseline. And then when they have some other stressor, some natural stressor hit them, they are less capable of dealing with it. So everyone is just kind of feeling burnt out and a little bit lost in this time.
So the importance of um, being able to communicate, at least by phone or even by FaceTime, for the adults to be able to share what they're feeling at this time, as well as people related to their own physical workplaces and their job security. Some families have lost or been furloughed. They've either lost their position or been furloughed in it, which has the stressors of financial and other insecurities. And how are you dealing with that?
Yeah, so again, it's just a matter of trying to self-care as much as you can. We can't control the economy, we can't control the pandemic, but we can try to keep our routines on track. We can try to get good sleep, we can try to exercise, we can try to eat well. We can try to just kind of stick to the facts of what we know. Okay, right now I know that I don't have a job, but that's not to say that in a month down the road I still won't have a job, right? Try not to fortune tell, future tell, or make assumptions about things. Just stick to the facts.
Now, some people that might have been inclined to abuse medications or other types of alcohol or whatever else may also be more challenged at this time. What do you recommend for them, and what should families be aware of with the stress that if someone has had any addiction or problems and may have been treated for that in the past, but now are showing signs and symptoms of needing intervention, what would you recommend?
Absolutely. So, families are probably aware of what the signs and symptoms look like in their loved one when they have started to struggle with substance abuse. So be a little bit more vigilant around that. Also, try to be a support. Let your loved one know that you are here to help them however they need to be helped. If you do have concerns about your loved one, reaching out to the agencies that provide those sorts of substance abuse services is a good step to help them.
Now, one of the things that when people are contained in the stay-at-home situation, they might not have been inclined to maybe have alcohol or might have in the past maybe a drink or so. But if family members are seeing that their loved ones are drinking more in order to cope and have not had a problem in the past, what would you recommend for them? What should they be watching for one another now in this close environment?
If you have concerned about a loved one, I always recommend honest and open communication. Gently point out what you're seeing. Hey, I've noticed that you've been drinking a lot more lately than normal. What's going on? I'm worried about you. Don't shame or blame. Don't be accusatory. Just, I'm worried about you. I'm here to support you. How can I help?
Okay. So going back to what we can do to perhaps talking about the silver lining of the COVID-19, the opportunities that it brings to us as families, and how we can make it positive and what we can do to make this experience a meaningful one, but that helps us to positively get to the other side. What would you say in that regard?
So, one of the silver linings is, even though spending a lot of time with our families can pose its challenges, it is giving us an opportunity to get to know them a little bit better, to get a little bit closer to them. It gives us time to self reflect, to explore new hobbies, to try things that maybe we haven't beforehand. And if anything, this is a learning experience for the future in terms of, we are the pioneers in how to navigate a pandemic. We are learning not only for our generation, but for future generations. These are the things that you can do. So I would say those are some of the silver linings that could come out of this.
You mentioned before some of the things that people can do, just this kind of summarizing to help them with their health and well-being and their mental health. Why don't we review that again? What you would recommend for that, please?
Sure, absolutely. So keeping some sort of consistency and structure in your routine. We don't want to be sleeping very, very late, staying up very late. We want to have good sleep hygiene. We want to have regular meal times, regular times in which we work, in which we do our leisure activities. We want to keep a structure in place. That'll just make us feel better, make us feel more productive, make kids feel more productive and better about the situation. Ensuring that you are taking time to self-care, taking time for you, engaging in activities that make you feel good is really important as well. Make sure you're eating well. Make sure that you are trying to be as creative as possible to break up the monotony of sitting at home. Those are some things that can help you feel a little bit better about the current situation.
So you mentioned before some physical activity, walking, running, exercise, going out in the garden, doing gardening or out in the backyard. Creatively, if they can't get to the beaches over the summer or to the pools, they can put up a sprinkler, put out seats, put on music, make it feel like they're away and having a good time and enjoying it.
Absolutely. Yeah, we got to get creative.
What is one of your best creative ideas that people could do to really kind of get it up and put a smile on their face and really enjoy being together in a positive way? What would you recommend?
I know a lot of kids love like forts and tents. So if you could put a tent up in your backyard and have a backyard sleepover or make a fort in your living room, kids go nuts over that sort of stuff. So, and that's fun for parents too. You get to be silly, you get to be young again. I would say that would be a really great activity to do.
Okay. So to summarize, the types of resources and where they can go to get help if they need it.
Sure. So again, in Nashua, Greater Nashua Mental Health Center is a wonderful resource. There are services for adults, children, and families. In Massachusetts, the William James Interface, it's a toll-free number that you can call, and you'll be connected with somebody who will give you local therapists that take your insurance. Psychologytoday.com will also provide you with a list of therapists in your area. And then there's also your insurance company that you can reach out to and get a list of providers from them in your network.
Great. Any good books you'd recommend for them to read?
Oh, man. Recreational books?
Yes, to help, within the environment and everything else, because that's another resource that can be a great escape, but also is good.
Yeah. So for kids, I love there's the Elephant and Piggy series, which is a really great series of books for kids to get into. For adults, man, there's a lot of really good crime books out there that people really enjoy. And then in terms of reading about how to talk with your kids, how to help your families, there's a list of websites that I think you're going to put up at the end of this that provides a good amount of reading material for parents to go through about how to help them and their children and their families navigate this.
Very good. I really appreciate your taking the time to be with us today to really discuss this very important conversation and topic. May we all be safe. May we all be healthy. May we all be well, and may we all live at ease. And thank you so much for all that you do. Be well and take care.